was 5 when we found out she had leukemia. It was the worst news. Dr. Lucas told us she needed a stem cell transplant. Thank goodness her older sister, Aaliyah, was a match. She's our hero. Ayana's doing really well now. We want to thank the Four Diamonds Fund and Penn State Children's Hospital.
Four Diamonds helps us treat kids with cancer. Your support means we can provide the most advanced care available. At Penn State Children's Hospital, we put your children first.
Thank you, Central Pennsylvania.
I was 2, and I was like 0. We were in a car accident, but nobody got hurt. Mom says our car seats kept us safe. Nurse Sue from the doctor's office checked them.
It's part of the Safe Kids program, thanks to Penn State Children's Hospital.
When you contribute to the Children's Miracle Network, you help provide advanced care and prevention programs right in your own backyard. At Penn State Children's Hospital, we put your children first.
Thank you, Central Pennsylvania.
You're watching Brainstorm on ABC 27, presented by Penn State Hershey Medical Center.
Brain cancer can hit even the young. Amanda Martin introduces us now to one patient who's beat the disease.
Well, I started out, I thought I had a concussion from football.
When John Sangrey started getting headaches and nausea that lasted until noon, he didn't think it was anything serious.
We were doing some pretty rough drills that week, and I just thought maybe I got banged up a little bit.
But it was not a concussion. It was a cancerous brain tumor the size of a golf ball.
I was kind of surprised and shocked at the moment. I guess kind of set in throughout the week.
We just were like, okay, now what do we do?
The Sangreys wasted no time. John had surgery at Penn State Hershey Medical Center, then radiation and chemo and physical therapy.
That was his first mile that he did on the elliptical. That was Jonathan's very first bacon cheeseburger after he could swallow.
John had to relearn how to swallow. He worked on his speech, his balance, and his strength on the right side. He has made major progress in just 1 year.
He has worked very, very hard, and he has had a very optimistic attitude about all of this, which has been great. So he needs to be commended for what he has done through this whole thing.
I slowed down a lot and learned to enjoy life more. Now that I've been at the most horrible part of my life, then everything's better from that.
At Penn State Hershey Medical Center, Amanda Martin for ABC 27.
We understand John's headed off to college soon. He wants to study speech pathology. He's a brave young man. You were his doctor.
I was.
He's got a little palsy on the right side of his face.
Right.
That's going to go away? What's going to happen with that?
It should improve in the next year or two.
Yeah.
Jonathan had a very aggressive malignant tumor in the brainstem that went right into the brainstem where the nerve that controls the movement to that side of his face comes out. We expect the weakness will get better, and it's starting to get a little bit better.
You guys are incredible what you can do. Do you want to talk about stem cell research and what's ahead with that? Do you think it's going to be done one way or the other?
I think it's up to the federal government at this point. It's difficult to get access to stem cells. I know they're looking at some different ways to acquire stem cells that don't have the same religious and moral implications.
Yeah. Or a private industry will just do it, do you think, if the federal government doesn't jump in?
If the government allows them to do it.
Okay. All right, well, we've got, didn't mean to throw that one at you, but it's a hot topic. All right, well, we're going to have some more questions for you in just a moment. First, Val's going to introduce us to a special guest. Val.
That's right, I am here with Sydney Bush. We're in the call center, so you may hear the phones ring behind us a little bit, but we're here with Sydney and her family, it's the Bush family, and Pete, Celeste's mom, and sister Katie. And first of all, Sydney looks like she's doing great, but you guys have been through some trials and tribulations. Tell me about her type of brain tumor.
She had what was called an ependymoma. She was just getting sick and was complaining about headaches and neck pain, and after a couple weeks, finally they did an MRI and found it, and she had surgery to remove it.
And she was only 2 years old at the time. Her prognosis?
Right now, she did have a reoccurrence in April, and she had surgery again, and they removed it. They were successful. We did have a follow-up MRI in the middle of the summer that came back with no sign of any tumor.
And you said that's something that you will have to keep checking throughout her lifetime?
Yeah, she'll be checked with MRIs for the next few years, 3 times a year, and then after 5 years, she'll go down to twice a year.
But just a regular, typical 4-year-old?
Very much so.
Now, how did you went to Penn State Hershey Medical Center for your treatment? Can you be a little bit more specific about what they use to take care of the tumor?
Well, that'd be a good question for the surgeon. I mean,
Was it the gamma knife?
yeah, well, she did have the gamma knife procedure done after both surgeries. That was kind of to, I guess, get rid of any cancer cells that may have been left behind after the surgery. So that was like kind of a trial thing to see if it works.
It looks like she's raring to go. We got her to stay still this long. And, of course, we want to thank Mom and Sister for being here. And you look good. Do you feel good? Yeah? But you're not going to talk, are you?
No.
I got you to talk. That's good. We want to thank you all for being here. And again, we want to remind all of our viewers that you can most certainly call in. The doctors are here to answer any of your questions, and that number is 346-3333. And as you can see, they're very busy and will take as much time as you need to answer any question that you have. Alicia.
Yes, and we hope people will call in. We really only have about 10 minutes left, so we're going to keep going and covering issues here. Dr. Sheehan is here with us. The stories of John and Sydney and their parents lead to our next question, which is, what questions do I need to ask when my child has a brain tumor?
I think many of the same questions you need to ask for adults, but in particular, I think brain tumors should be treated by a comprehensive team that sees a good rate of brain tumors. It sees a fair number of brain tumors over a given period of time. That sort of volume allows them to keep up on the latest developments and changes in practice and recommendations and treatment regimens.
Okay. Here's another question someone wrote in. It's kind of a long one. Take a look at this. My brother-in-law is currently undergoing chemotherapy for primary central nervous system lymphoma, and he's having a difficult time after each treatment. He attempts to do so, but says nothing tastes good. What can he do? Is there some kind of nutritional drink he can use if he just won't eat?
Yeah, this is a common problem with chemotherapy, not just for brain tumors, but with any kind of tumor. It's a loss of appetite, it's a loss of taste and appreciation for food and taste and smell in general. There are some medications that can stimulate appetite, may make things a little bit better in general. There certainly are a number of commercially available nutrition drinks which provide a balanced intake of certain nutrients and proteins, carbohydrates, fats that everyone needs. So that's a good way to supplement inadequate oral intake.
Okay. And we've got another question again about clinical research. So it's another long one, so we want to show it to you. Someone writes in, my father, who will turn 80 in December, was recently diagnosed with metastatic melanoma of the brain. He underwent full brain radiation with no results. He's turned down starting on the drug, how do you say this, Timodar?
Timodar.
Timodar, due to the low result rates and the side effects. I've researched clinical trials for this type of cancer. Are you aware of any trials he might be eligible for?
There are some trials available for melanoma. The problem with metastatic melanoma to the brain is it doesn't respond well to conventional radiation treatments. It does respond to single fraction high dose treatments like we can deliver with the gamma knife, but to the traditional radiation treatments that you get for lung cancer, breast cancer, melanoma doesn't respond. The Temodar is used because it's chemically similar to a drug called DTIC that's used for melanoma elsewhere in the body. Temodar gets into the brain in higher concentrations, and I think it's very well tolerated. It's an oral drug. People usually don't have a lot in terms of side effects, and that might be a reasonable choice to try in this man's father.
Okay. We talked about earlier how obviously the brain affects everything, and that's one reason brain tumors can be so scary. What about affecting a person's emotions or their intellect or personality, is this question?
Absolutely. The tumors can affect the brain function in any way. One of the ways is by displacing or compressing the brain and affecting its function through pressure. The other is by actual invasion of the tumor into the brain and directly injuring or affecting the pathways that conduct the electrical impulses. One of the things our group is very forward-thinking in looking at is neurocognitive outcomes and personality changes in patients with brain tumors. We've got a number of ongoing research studies to look at those things. It's a critical area in terms of quality of life. We focus so much on survival and length of life, but quality of life is a very important factor.
And one of the doctors I think that's here with you today who's in your group specializes, doesn't she?
That's right.
In the kind of emotional changes and other kind of changes that can happen when you have a brain tumor.
Yeah, that's Dr. Elena Ferrace, and she's really a national expert and a leading national expert in neurocognitive outcomes in brain tumor patients.
Okay. And you talk about the research. I mean, you guys are doing a lot of exciting research at Penn State.
Well, I think it's exciting. I'm excited about it. Dr. Connor's lab has a lot of very progressive ideas and treatments for malignant brain tumors, and there's a lot of research in the institution in general.
Yeah. I mean, didn't the cervical cancer vaccine, obviously that's not what your group would focus on, but I mean, that came out of Penn State, didn't it?
I think so.
Penn State Hershey, okay. Well, let's take a break and we'll come back and do more. Coming up, help for people who care for a brain tumor patient. We'll be right back.
Brainstorm on ABC 27 is presented by Penn State Hershey Medical Center.